This next question, please don't take offense to the questions. These are the things that we're hearing in the
Never.
Okay. The vaccines do not seem to be working, so why take the risk?
Okay, I can start with this one. This is a really important question because we hear it all the time. People are still getting infected, so what's the point? And if we remember the whole purpose of these vaccines, and it's to prevent serious disease and to prevent hospitalizations and death. That's it. It was never really meant to prevent infection. Now, in the beginning, we thought, oh gosh, this was like a nice little, how well these vaccines work. But this is similar to, say, to the influenza vaccine. When people come back and they say, man, it didn't work, I still got the flu. I said, thank goodness you did, because you could have gotten, really sick had you not. So these vaccines, they will prevent you from dying from COVID, by and large. And it's almost analogous to seatbelts. Once people started wearing seatbelts, lives were saved, but it did not decrease the number of car accidents that we were seeing. So it's still very important to get vaccinated, even though people are still getting infected.
Yeah, I'll add to that. I mean, it's really hard. I mean, I get it because, I think what drives that question is that everybody is pretty tired of hearing about COVID. They're tired of seeing it. They're tired of getting it. The people who've had it once or even more than once, they're pretty tired of COVID. And I think that's where a lot of this comes from. And the truth is, like Dr. Berman said, that the vaccines were not necessarily designed to prevent. It's really hard to design something that actually stops you from becoming infected. All right. Most all of our vaccines are not designed to do that. They're designed to prevent you from getting very seriously ill or getting the complications. Because of the way the immune system works, it's very hard to prevent someone who's exposed to a disease from actually getting an infection. What you can prevent is how sick you get. And that's what the vaccine is designed to do.
Well, I'm going to take a contrarian point of view with this a little bit. When the vaccines were first developed, we were hoping that if they had a 50% efficacy rate, that would be good. And instead, it was a grand slam home run. It was out of the ballpark, 90-some% reduction in the number of infections. And then, so that part was unexpected, right? And unfortunately, what I think that did was that took people's eye off the ball, right? And so the ball is that it's not so much do I get infected, do I don't get infected. In many ways, in some ways that's irrelevant. In some ways it's not. But it really is who's getting sick and who's getting in the hospital. And one of the big problems that we faced was that we were worried that our hospitals would be overwhelmed. And, we certainly saw that early on in the pandemic. We saw in New York, the New York City hospital system was on the verge of collapsing. So in other words, if you had a heart attack, you wouldn't have a place to go. If you broke your leg, you wouldn't have a place to go. And it was similar in New Orleans too. Unfortunately, we never got there, and we were fortunate in the sense that we were able to see what was happening in these other places and prepare for it, so it didn't happen to us. But so that's the first thing that it prevented. But it still also prevents you from getting infected. So it's a little bit of both, and it either reduces the severity or keeps you from getting it. If you get infected, is that a failure? Not really. And I think that's the real thing. So why do people say, well, why should I take it if it's going to get? Because they don't want to get vaccinated. All right. That's why they're doing that. Okay. So this is America. If you don't want to get vaccinated, that's fine. You don't have to get vaccinated. We're not forcing people to get vaccinated. But we are really strongly recommending it, and trying to convince people and cajole people, and just let people know that it's really safe, and you're better off getting it than not getting it.
And with that, both Dr. Dasha and I seeing patients in internal medicine clinic as well as in the hospital, people who are getting sick now with Omicron, they're sick at home. Right. Versus people who are unvaccinated and getting sick with Omicron, they're in the hospital and they're just as sick as they were with every other variant that we have seen. So there's so much value to, getting that vaccine to help prevent that serious illness that we have seen firsthand.
that's the perfect segue to this next question, which is the vaccine mandates have been dropped. So that means we're out of the danger zone with COVID, right?
No, 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 no. Where I think what we do is we confuse the legal and the civil rights and personal liberty issues with the issues of whether COVID is a threat and a danger. Okay. And and the courts really have come across and given kind of mixed responses to this. They've said basically, if you're in certain professions, your employer has a right to require you to get vaccinated. And those are things like, doctors and nurses and we all, I think most of us vaccinated voluntarily, but there were doctors who've held out and didn't want to do it. In the military, that's a unit of readiness. They've all been vaccinated. And in some cities, even the police and fire are required to get vaccinated. And the courts have said that's okay. That's a big difference between, say, like a guy who works in a paper factory and saying, oh, you have to get vaccinated, right? And what's the negative consequence to society? Well, he might spread it to some other people. He might not. But should he lose his job because he's worried about getting the vaccine? And I think the courts have said not. So, the other thing is that from a public health point of view is mandates can work if you have a broad consensus. And what that does is that gets you the kind of the people on the edges that just don't, and so, between them, oh man, I guess I got to do it or else I won't be able to get on the airplane, or I got to do it or I won't be able to go on my cruise, or I got to do it because I won't be able to do that. So that kind of, or I need it for my job, that kind of pushes those people. But with it, the country so divided, I think the mandates for the general population have just divided things even more.
Yeah.
And so what that means is that we as health officials, what we have to do is we have to do a better job of convincing people that this is the best thing for them. Matt, I'm sorry.
Yeah. No. Sorry. Yeah, I was going to echo everything you said, and sort of to the point of the question as well. We have this tendency to think that it's the CDC or it's the courts that tell us when the pandemic is over. And the truth is, it's the virus that's going to tell us when the pandemic is over. Viruses are smart. Viruses evolve. Viruses they change, and we're lucky that the dominant variants seem to be clinically less severe. Some of that is because of the nature of the virus. Some of that is because we've had so many people with immunity and who are vaccinated. But the pandemic's over really when the virus says, okay, I'm now part of your, the normal respiratory pathogens in your society. And we're still probably not quite there. We're still seeing increasing cases, still seeing surges that come up. That's not an endemic disease. That's still a virus that is figuring its way towards endemicity.
Yeah, and I do think, though, we are in such a better place now than we were 2 years ago, and I think everyone is so much more comfortable and not scared anymore. Us three physicians that I know are vaccinated and boosted, so we are, and we know that if we were to get sick, that there's an antiviral out there if we need it, or if we have patients who need it, or if they're immunocompromised, or say they don't mount a good immune response to the vaccines, we know that there are therapeutics we can give them antibodies. So as far as danger zone, it's hard to say because, again, things have not stabilized, as Dr. Dasho has mentioned, but we're in a good place. We are at this time, especially if people are vaccinated and up to date, this isn't something to be scared of.
Okay, so here's one for you. I have already had COVID-19 and have natural immunity. So why take the vaccine?
Because you'll have better immunity if you take the vaccine.
Okay.
It's that simple. If you want to talk about it some more, matter.
No, I want to say just my favorite thing to say is that, that all immunity is natural immunity. So whether you get your immunity from having the virus or you got your immunity from a vaccine. It's all natural because you made it, right? Nobody gave you that immunity. The only immunity that's not natural is when it comes via a monoclonal antibody infusion. That's made in a lab, right? So natural immunity means you got an infection and you cleared it, or you got a vaccine and you produced antibodies. So it's natural immunity plus the vaccine is excellent, right? Those are, like Dr. Kaiser said, that is, if you were even in the first couple of waves of COVID, you made antibodies, they went away, you made other cells that remembered it. If you then get a vaccine, you're in great shape. And vice versa. If you got vaccinated and then you got exposed to the virus and you made a really great response because of your immune system knew what to do the moment it saw that virus, you now have even better immunity. So them in combination is quite good. That's not an advocacy. That's not a recommendation to go out and get infected. We've seen some people turn that into, well, we need to have like the old chickenpox parties. We need to have COVID parties. I do not recommend that. That's you still don't want to take the risk, but you can feel very confident that if you have been vaccinated and you get infected, or you had an infection and then you get vaccinated, you have excellent, very protective immunity.
Go ahead, Megan.
The CDC does recognize natural infection, as having an immune response. So if you do get naturally infected, you don't have to rush necessarily to get that vaccine. You can even wait a few months before you do get immunized. But that said, the thought is how serious of infection you have may also be a correlate of how strong your immune response. So if you just got COVID and you're sitting at home or had a mild infection, you may not have as robust of immune response. Whereas vaccination, there is a more predictable vaccine response that we know just by doing all these clinical trials is high level protection. So, and again, natural infection, or, if you were to expose the actual virus plus vaccination really does, it almost gives you this super immunity that does give you a nice broad response protection, not only towards, the circulating virus of the day, but what we found is to other variants of concern that have been circulating, there still remains to be protection.
Yeah, I would just say to those people who say, well, I'll get natural immunity. I personally know people that have died from that strategy. And I think two physicians can say the same.
Well, our next question is, I'm not sure which vaccine is the best one to take. Is there a difference?
Well, we used to say that whichever one you can get, but actually now there's a little more guidance. Yeah. So there's 3 vaccines that are approved in the United States. We have the 2 messenger RNA vaccines, the Pfizer, Moderna, and then we have that one, the vector vaccine, the Johnson & Johnson. And it's actually recommended to get either Pfizer or Moderna over the Johnson & Johnson, just because of a very rare but serious side effect of this thrombocytopenia syndrome, which is basically when someone has this reaction to the vaccine where they have very low platelets and causes your blood to clot. Extremely rare. But that said, because we're in a society where we have so many vaccines available, it's recommended to have one of the other 2. Now, I've been asked which one to get. They're both fantastic. An A is an A. It really doesn't matter. So you just get the one available. Either or would be fine.
Here's the next question. I'm afraid that once you decide to take the vaccine, you'll be required to take a seemingly endless number of boosters to be considered fully vaccinated. I'm just not sure I want to go down that path.
What does that mean?
I'm not sure I can answer the question, but we have heard that quite a few times in the field.
Yeah. It's okay. I don't want to get vaccinated. I want to get vaccinated. I kind of get that. And but you take the vaccine to protect yourself, right? And I think that's the big thing. I know people that try to time their boosters. Oh, I don't want to get my booster yet because I'm going to go on a trip and I want to get it before I go on the trip. And I know a couple that was thinking that, and they got COVID last week. I think the best thing to do is just to follow the recommendations until we're through this. We all ask people to get a flu vaccine every year. It may come to that, right? And that's just the way it may be. Or we may find that, after you get 3 or 4, depending how old you are and what kind of conditions you have, maybe you don't need additional vaccines. We don't know. We don't know the answer, but it's not like you're getting committed to something and someone's requiring you to do things. So it's kind of just I just find that an odd argument, because you can do what you want, but we would recommend that people go ahead and get it. And just like we'd recommend people get a flu vaccine, just like we recommend that, people get their pneumonia shot when they get to be a certain age. And then after a certain period of time passes, you get another one. Just like if you've had a tetanus shot, you get another one after a certain period of time happens. That's just pretty much the way vaccines work.
Yeah, I want to just tack on real quick. I completely agree. And I think that I've certainly had that discussion with a number of my patients. I'll say, oh, hey, it's time for your COVID booster. And they'll say, I don't really want the booster. So the issue of mistrust and not wanting to get the vaccine in the first place is no longer the concern. So when I speak with them, at least in my experience, and Dr. Berman can probably weigh in here too, it comes down to they're really just tired of COVID. And every time we ask them about a vaccine, every time we hear something new, or now there's another booster, people say, oh my God, can't it just be over? And it's just this is a reminder. For many people, it's an emotional decision. It's not a scientific based decision. It's just based on feelings. And I understand that. Like you got to meet people where they're at. That's their feeling. I say, I acknowledge and respect how you feel. Same time, here's what we know. We know that when these things were tested as a 2-dose series, that we followed people for a few months and it was great. But then as we got more experience and we started to see the results of antibody tests come back, well, boy, those antibodies really go away after about 6 to 8 months. After 2 doses, you're really probably not having enough to fight off new waves of infection. So that's when the booster studies and then came out and said, wow, this really reignites the immune response. Listen, we have many series of vaccines that are 3-dose series. Many people get their kids HPV vaccinated. Those are 2, and some populations 3 doses. Hepatitis B is 3 doses. Dr. Berman knows all of the 3-dose vaccines series way better than anybody else. But this is that we are learning about this through rigorous scientific study in real time. So it's very hard for people, I think, to understand that it's not a lifetime, it's not a live experiment. It's actually lifetime science generation in process. We are learning as we're going. We are following very, very strict scientific protocols to come up with these recommendations. And nobody would recommend something. Certainly no clinician, no health system is going to recommend something that we think is going to hurt someone. So if your doctor or your health provider is recommending a booster, it's good to consider it. Go ahead, Megan. Sorry, I know you want to get in there.
Well, and to clarify the number of vaccines, the CDC considers someone fully vaccinated if you have 2 of the messenger RNA vaccines or 1 of the Johnson & Johnson vaccine. But then they throw on that up to date by having that 1 booster. And really, just to echo what my colleagues have mentioned, this is really a 3-shot vaccine. It's, once you get those 2 shots, it primes your immune system. And then once you boost it months down the road, you actually have a better immune response. So like many vaccines that are given in series, this should have been all along, arguably a 3-shot series. Now, again, because of the pandemic, they had to get these out so quickly. So it was just, it would have been almost inappropriate to wait that long when so many people were just at the edge of their seat wanting to have some sort of protection. And then of course the recent news, like, oh, well, you could get a second booster if you want. And I think this is where people are getting kind of tired. Like, are you kidding me? I just had 3, what do we do? And, when we look at that data, it depends who you are. And if you are someone who's much older, when they look at the Israeli data, there's over 1 million people that they studied, and they showed that really the most benefit is in an older population Less so in a younger population. When they looked at healthcare workers, a second booster didn't really make any difference. But in an older population, older than 60, 70, probably even, older than 80, if you got 2 shots at the time, it gave you 55% protection, 3 shots gave you 88% protection. And then that extra booster bumped it up to 95. So, it's a smaller benefit, but it's still there. But we don't know the future. We don't know if one day this virus is going to evade our immune response. Then yeah, we may need another vaccine. But as of now, you should have 2. It'd be great if you had 3. And then if you want that extra one, if you have a healthy immune response, okay. Now, if you're immunocompromised, that's another story. You do need that extra one. But I think many of us are at least advocating to get that first booster. And then after that, I just have a discussion with my patients if they would like to have that extra, that second booster.
Next question is, we have achieved herd immunity and now there's no need for the vaccination.
No.
Okay. Fair enough.
Yeah, I mean, herd immunity is it's a moving target. Let's put it that way. And people really largely misunderstand what it means. And so, I mean, if we had quote unquote herd immunity, we wouldn't have surges, we wouldn't have waves, we wouldn't have people in the hospital, we wouldn't have new infections. Like we're not there.
And we're never going to have herd immunity for this. And the reason for that is, there's animal reservoirs for this virus. So it can be transmitted, via many other animals other than humans. It has a long infectious period. So people can be infectious before they have symptoms. And the symptoms look like any other respiratory germ that we see. And then lastly, as we talked about before, these vaccines, they are meant to prevent severe disease and they're not sterilizing, they're not going to completely knock it out. So unfortunately, unlike smallpox, this is not something we're going to be able to eradicate, with herd immunity.
How do I know that I need to take the vaccine since people are using home tests and we really don't know how many people have it now?
I think those are true and unrelated.
Yeah, right. Exactly. Yes.
Yes, people are using more home tests. That means that we don't actually have a great idea of what's happening epidemiologically in the community. We don't know test positive. All we had were PCR tests. We had a great way to follow, symptomatic disease, test positivity. We could see things go up, see things goes down. We know what the degree of risk is in the population. With people using home tests, we really have sort of lost that. So that's one true fact. But it has really very little to do with the decision to get a vaccine. We have safe and effective vaccines that prevent hospitalization, death, and other complications from this infection. That's the reason to get the vaccine. Has nothing to do with whether there's a lot of it in society or not. Because when it goes down, I can guarantee you it's just at least until we're out of the surge, the peak valley pattern of the pandemic. It's just kind of a question of time of when it comes back. So the best time to get vaccinated is anytime.
Yeah. No, I would just reiterate that. And I'd also say that no matter what your COVID status is, everybody should get at least one shot, right? If you haven't had any, get at least one. And then, get the other one. If you've had COVID, get at least one shot. If you've already had your 2 shots, just get one more, So I think it's time for everybody to get at least one shot and move on. And it doesn't really matter whether you've had COVID in the past or not.
This next question, you may not have any comment at all on it, but we do get it a lot. And that is, I don't trust the government. And it seems odd that our leaders are pushing the vaccine so heavily.
Yeah, well, I don't trust the government either. So I work for the government. But so I think we've heard that from both sides, right? And quite frankly, the Republicans were in power, we heard some very prominent Democrats saying, "Oh, this process is too fast," or "I don't know about this," and and then the Democrats are in power, and the Republicans saying, "I don't trust it." So so what we see is it's become very politicized, and people are feeding on that, right? And so I think it's important that people be aware of that, and be aware that there are people who will spread misinformation and put doubt and feed that discomfort with that we may have with with our institutions to their own ends. All right. And what we're trying to do is we're trying to be completely honest with you. I don't get paid any more if people get vaccinated. I don't get paid any less if people don't get vaccinated. I get no benefits. Nobody here, my colleagues, get any benefits from this. It really is just something where we're trying to tell you the truth as best as we know it. And we're not tools of the Republicans. We're not tools of the Democrats. I'm not an active member of any party. I vote just like everybody else. I know, my friends here, I know them. They're not, politically active. We're just trying to do the right thing and let people know what the right thing to do is.
Yeah. And this is something, again, this happens both in community and in our patient rooms. People say, I just don't, why is it that the government's pushing this so hard? I mean, really, what are they trying to do? I get it. It's hard when this is hard when someone, especially a government entity, is telling you what to do. But this is public health. Vaccination is one of the things that has actually prolonged the longevity of our species on this planet, right? The development of vaccines has been one of the advances that has made it so you don't die in your 40s from typhoid or from yellow fever or from other diseases. It's one of the things that has really prolonged the longevity of our species. It's helped us to be on this planet, and public health. All of the things that, on their way to the doctor's appointment, I asked them, I said, they say, are they, I don't trust the government. I don't trust them to give me the vaccine. I said, okay, did you stop at the red light? Did you put on your seatbelt? Did you put on your blinker before you turned at the light? Did you pull into a parking space that was designated? Did you pay for this clinic visit? There are lots of things that people tell you to do. You just do them, right? And some of those are public health interventions. They were done, decades when seatbelts first came out in cars. They were an add-on item, right? And it wasn't until people realized just how many lives they saved, they became mandated. Right. And people hated them. They were pissed off about them. They were yelling and screaming that seatbelts were just terrible. And why is the state telling them to do it? And then, over time, we realized that's actually a really important thing. Airbags the same way. So, these are all interventions that help to keep us safe. And the vaccines are just one more in that whole profile of things.
Yeah. Yeah. So how many people have died from polio or had polio?
Right.
How many people do you know that have died from tetanus? How many people do you know that have died from rabies? And on and on and on. And there's a reason for that. Okay. And let me tell you, these vaccines, these COVID vaccines, they're better than those vaccines. They've been more meticulously made and better studied. We know more about them than we know about some of these vaccines that have been around for 100 years, because 100 years ago, we didn't study things the way we did now.
So the next question is, I don't want to get it because I'm young and I can recover from COVID-19 if I were to get it.
Well, odds are that young and healthy people are going to recover and not die from COVID, right? Those are just playing the odds. However, young folks, they can become seriously ill. They can be hospitalized. I know many of us physicians have heartbreaking stories about young people, during different surges who are unvaccinated that died. 35-year-old mother of 3, so a 19-year-old who's pregnant. I mean, those are the things that just you bring home with you and you just wish you didn't have to. And there's poor families. Now that said, and I know Dr. Kaiser brought this earlier, there's also long COVID that we are seeing more and more that, 10 to 30% of people can get. And again, it's regardless of how severe the infection is. And the vaccines have been thought to help reduce the risk of getting long COVID. And that can be anywhere from just prolonged fatigue, prolonged, difficulty concentrating, or maybe even having just this prolonged cough that's just a nagging cough. And everyone's gotten cough shamed every now and then. So, I mean, you just don't want to be doing that. But also if you're active and you want to exercise and you're feeling short of breath, and then also there's the complications of the virus itself. There can be blood clots that can form. So people can, have the infection and then get a blood clot disorder after that, where they have to be on blood thinners. And that can certainly hamper, lifestyle, especially if someone's really active and likes to play sports and, worried about bleeding. We talked about that myocarditis, that concern with the vaccine. Well, again, you're more likely to get myocarditis from the actual infection, which is much more dangerous than they are from the vaccine. So, it's like anything we do in life. It's risk that you get in that car. There's always that risk of getting into a car accident, but you still want to go to point A to B. The vaccines are just going to help really reduce your risk of having all those potential complications when we know that the virus is just so common and so prevalent in society.
This is a good one. Someone I'm close to had a bad reaction after they took the vaccine, and I'm afraid to take it.
Yeah, no, we certainly have seen people have had bad reactions to the vaccines. And when we were doing the big drive-throughs, we actually had an ambulance on site, and it would be like every other day we'd have to transport someone. A lot of times it was ultimately turned out not to be something that was related to the vaccine, but there are some people that do have a reaction. These reactions are exceedingly rare. And so for the most part, people are not going to have a problem with it.
Okay.
Yeah. And I mean, it's, I have had a lot of these conversations. And when you think about the totality, you start to wonder, wow, is everybody having a friend? Or do they all have the same friend who had the bad reaction, right? Or was it a friend who posted their bad reaction on social media and they're like, oh, but I got this friend, you see, he's my friend on the internet, and he had a bad reaction. And the truth is, like Dr. Kaiser said, if we made all of our decisions based off of what we heard from friends, then we would never do anything. I mean, I have friends that have shared some gruesome tales about crossing the street, be like, well, I guess I just have to stay on this side now. I mean, it's tough. It's tough. What we know is that, the government, the CDC follows all reactions, get reported. And whether it was related or not, it gets reported. Now that has gotten published and blown up in various circles as sort of pointing to, oh, look at all these complications. But if you stub your toe after you get a vaccine, it can get reported, right? And it's reported by the user. So, depends on who's reporting. What I'm saying is that the data are not convincing that there's any problems with these vaccines. And even if we were to take all of them at face value, we have had hundreds of millions of these things deployed throughout the country, and the number of reactions and complications are profoundly rare.
Yeah, just let me say a couple things. So when we talk about, I'm not sure exactly what the person means by bad reaction. What we talk about with bad reactions or vaccine reactions is if someone gets the shot and has an allergic reaction, immediately requires medical care. That's very, very, very rare. It is not uncommon for people to have muscle aches and sometimes feel a little feverish and just not feel well, although that can be highly, highly different in two different people. For example, in my own self, I got the Pfizer vaccine, my first shot, I had a sore arm. And then my second shot, my arm just felt like it was on fire, and I was feverish, and I was, I felt a little dizzy, and my boss was talking to me in a meeting, and he said, "I want something done by the end of the day." And I realized I had no idea what he just said, other than he wanted it done by the end of the day. And, so I had to go home and take some Tylenol, and I felt better. My wife, on the other hand, got the same vaccines the same day I did. She thought nothing. And I think that's kind of the range of what people can feel. But also, to put it in perspective for you, recently I got the Shingrix vaccine, which Dr. Berman gave me, and it was 10 times worse than any COVID vaccine. Let me tell you that right now. And, but it depends on the vaccine and the individual reaction to it. And so don't let the fact that someone had a bad reaction scare you off. At worst, you'll feel bad for a day or two, and you'll be fine.
Yeah. Reactions are common after vaccines, and the most common reaction is going to be your arm is going to be sore. And with the COVID vaccines, that's been reported nearly 80% of the time. And then it's going to go away after a few days. And then after that, maybe arm sore, maybe a little bit of redness, other signs or symptoms could be fever, could be body aches. There could be those lymph nodes that could be swollen. So that's why with women who get the messenger RNA vaccines, it's recommended to hold off on getting the mammograms about 4 to 6 weeks after, just because radiographically it's hard to tell, is that your body mounting an immune response, or is that, something that needs follow up with another imaging. But yeah, nothing, some people can get hit by lightning. Some people, there's just so many very rare things. But, in the United States, there's been nearly 600 million doses that have been administered. And the fact that these are so rare, just really complements the safety aspect of them. And I know this has been on the news about having the milestone of over 1 million people dying from COVID. This is really something that that's why we're all on this call. We really want to keep making sure we prevent as many vaccine preventable illness and deaths as we can, because this is a vaccine preventable disease.
Very good. Very good. Well, this is the final question, and I'm not sure that we haven't answered in a roundabout way, but it's probably a good way for us to end the Q&A part. And that is, with all of the conflicting information I see out there every day, it's confusing me, and I'm just not sure I want to follow through with it.
Yes, this has been a pandemic of misinformation, and it is definitely very confusing. I'll tell you, a lot of people that I've seen in the hospital, when they have not been vaccinated, it's not because they're anti-vax or they don't, they just didn't know, and they were confused and they were scared. And it's heartbreaking, because there is a lot of misinformation out there. I think a good rule of thumb is to probably avoid social media outlets for medical information, and really to rely on, healthcare professionals, your doctor. And if someone doesn't have a primary care doctor, it'd be a good time to get established. But also, there are some websites out there that are verifiable. The CDC has really great information. UTMB, we have a COVID webpage where we have information. A lot of academic institutions are going to have their own COVID information. But really, at the end of the day, I would avoid Facebook and name your, social media, and really talk to a healthcare professional.
Yeah, I'm going to let Dr. Kaiser have the last word, but I'll just say very briefly, I agree with everything Dr. Berman said. It is hard for people we have had an explosion in the amount of available information in the last couple of decades. It used to be that people could just kind of rely on a couple of trusted sources. You turned on the television, it was Walter Cronkite. That's where you got your knowledge from, right? Like, there was a time where the information was very scarce. And as we've gotten much more technology, internet has grown, we have just endless amounts of information. And it is really hard to sift through what it all means, especially when it's a new pathogen in a new population, spreading in ways that we still are trying to understand, right? We were changing information. That's what happens in science, right? We get new information, we change, right? Just look at aspirin, okay? Aspirin is the best. Now aspirin, not so great. Aspirin's the best. And though it's only in these certain population, we get new information, we have to change. That's what we do in science. That's what we do in medicine. We evolve, we change. And that's what we have to do is we have to metabolize that and help our patients understand, right? That's hopefully what you trust us to do. That's why we go to school. That's why we do all this training, is so we can try to distill this information into something that's going to help you live the healthiest life possible. Your public health experts the same way. Problem is that as information has gone out there, it's made it very difficult for people to make those decisions. So we hope that, like Dr. Berman said, you'll go to trusted sources and certainly ask your local health authority. They are really wonderful sources. So with that, I'm going to hand it over to Dr. Kaiser.
Yeah, all I've got to say is this: is as soon as the Ukraine war started, there was a meme on Facebook showing Forrest Gump that said, "And just like that, everyone on Facebook stopped being infectious disease experts and became international relation experts." So there you go.
Very good. Well, great. Well, hey, I want to thank you all for joining today. I can speak from experience that this is going to be a real asset for us with the work that we're doing. And I think it'll be great for any user who wants to view it. But before I close, I wanted to see if there was anything else that you all wanted to tell the audience.
Get vaccinated.
Get vaccinated. Okay.
Yeah, I boost that remark.
All right. Well, thank you again, and you all have a blessed afternoon.